So we are talking about the truth about natural remedies for arthritis, and it's a really big topic, really interesting topic, but it's a big one. So we're only going to focus on a couple of the common remedies that we most hear about and we most get questions about today. I will begin with acknowledgement of traditional owners. We acknowledge the traditional custodians of the land on which we gather today. We pay our respects to their elders, past and present, and recognize their continuing connection to land. Now, our webinars do contain very general information and advice. So, what that means is that everything we do our due diligence to make sure everything's evidence based and backed by the science. We speak to the science, but it's not to substitute any individual treatment advice. If you do have questions that relate back to your individual treatment plans, I will always direct you to your main healthcare provider. But in saying that, there's going to be lots of time for questions at the very end of the session. So I'll open the floor to questions at the end of this presentation. If they do pop up as I'm covering some of these topics, I will encourage you all to just chuck them into the chat box. You can see that on the toolbar at the bottom or the top of your screen. So I will kindly ask everyone to just direct all questions into there so I can circle back to them later. At least we make sure all the grounds are covered and we're not forgetting anything. So today's session, we're just going to go through understanding natural remedies. I like to talk a little bit about the difference between traditional and scientific evidence. Focus a little bit more on the common remedies that come up a lot in questions. I'm not focusing on all of them, and that's mainly because you could say this session is extending to another webinar in a couple of weeks where we're focused more on dietary supplements themselves, but I'll focus on things like turmeric, Boswellia, and many other ones that I'm sure have played on your mind before. And we'll talk a little bit about those safety considerations. So please don't mind me as I continue to let people in this session. It's a big one today, good turnout. And so, natural remedies, I'm really interested to hear from you. And please just write this in the chat box. If you've ever explored complementary therapies or alternative therapies and what remedies you might have trialed before, we actually know that approximately 70% of people who have arthritis take or have taken some form of complementary therapy or alternative medicine to help manage their disease, and whether that's to manage symptoms, pain, to cure the disease, slow progression, or maybe it's exploring these natural therapies to improve overall quality of life and general well-being. We know fatigue management is a huge part of living with a chronic pain condition. So maybe it's exploring supplements or remedies to try support that. But complementary therapies are also known as natural therapies and can come in the forms of herbs. This could be like turmeric, boswellia, CBD, supplements like glucosamine. There's topical creams, ointments, dietary adjustments are included within this. Um, you know, umbrella, and then there's sprays and many other more. Sometimes they're actually used along other medical treatments to relieve symptoms. Some people use them to support that general well-being. Medically, dietary supplements can be used to treat nutrient deficiencies. So, whatever the reason might be, it is mostly personal. And while some of the therapies are backed by really promising evidence, a lot of them are very limited, or there are claims that haven't exactly been proven if you're considering the scientific evidence. So it's really important that we're able to explore them with a critical eye. We can speak to a healthcare provider and explore these while making the most informed and safest choices for ourselves. So in Australia, it's really common to seek out multiple forms of support for arthritis. There was a really large study done back in 2022 that looked at people living with arthritis and what type of therapies they were undertaking. But they found around 35% of people had consulted a complementary medicine practitioner, and that could be someone like a naturopath, acupuncturist, nutritionist, or herbalist. And an even greater number of people reported using complementary medicine products and practices on their own. So, using things like supplements, herbal remedies, natural topical creams, without any guidance or support when it comes to selecting those products. So, what's really interesting is that most women in this study were combining different types of care. So, rather than just choosing one or the other, they were actually blending conventional and complementary approaches. Sorry, I'm just going to mute everyone. 19% of women consulted three different types of providers, and that um, primarily looked like a doctor, allied health professional, and a complementary medicine practitioner. 27% consulted two of the three, and then 6% of people relied on only complementary medicine practitioners. And so it's important to, when we're exploring this, we do ask why they are so popular. Some people, it's about having more control over health. Some people prefer that more holistic or natural approach when it comes to treatments and solutions. It could be that you want to explore those alternatives to medications, and that could be due to the past experiences with side effects, or maybe it's limited relief, or you can't disregard the importance of cultural traditional beliefs as well, and traditional healing practices. But then for a large part, it's marketing, it's friends, it's online testimonials. I know when you jump on social media, there's a lot of claims made about certain products and how they could help with our health. So while natural sounds safe, for a lot of products, that's not always the case. Not all natural products are proven to work. Some might cause side effects or interact with medications. The quality and regulation of natural products can vary widely. So, all these things are really important to take into consideration. And this is why we run these webinar sessions. This is why we give you the information to know just how important it is to navigate options safely and effectively. But then, if you go into the supermarket, you are faced with thousands and thousands of products, and some of them are quite expensive. So, you want to know how to weigh up those costs with expected benefits. So I'm just letting some people in. When we're talking about evidence base, it's really important to know that not all therapies actually fit into the same evidence box. We really need to think broadly and be clear that there's a difference between traditional evidence and scientific evidence. Traditional evidence, it essentially comes from the long-standing use of certain herbs or therapies over generations. So these evidence based products are very much grounded in more traditional systems of medicine. So, Ayurveda, which turmeric is very much grounded in, or willow bark in traditional European medicine. In Australia, for a product to be registered as a traditional medicines with evidence of traditional use, it generally means the product or the key ingredients in the same preparation and dose form have been consistently used for the same person for the same purpose for at least 75 years or across 3 generations. So there's a lot of research that suggests while traditional remedies don't outperform placebos in clinical trials, keep in mind these clinical trials are built on scientific principles, and if it offers a benefit to someone, it doesn't mean we should disregard it or ignore them outright just because the scientific evidence doesn't hold up. Scientific evidence is what we usually use in modern healthcare, evidence that has been collected from really high quality study designs, methods. So we're talking randomized controlled trials, lab studies, systematic reviews, the kind of evidence that is used to inform those clinical guidelines used in conventional medicine and medical decision making. So different types of evidence. Then we have natural remedies like fish oil or methyl sulfonyl methane, which you might see as MSM. It's usually a product that's formulated and marketed for arthritis pain. But these are natural products not derived from traditional medicine systems, but they do come from natural food sources. So they can be used as concentrated supplements and are very much a modern development driven by nutrition science. So you could call them nutraceuticals, and they also have their role when it comes to adjunct therapies. So, ideally, in any plan of management for any chronic condition, the treatment should always take a person centered approach, meaning you should be at the very center of your treatment. Your treatment plan should be tailored to you, your needs. And when you're exploring those natural remedies, it's really important that your lived experience is acknowledged, your medical condition is acknowledged. Prioritize what works for you, provided it's safe, it doesn't interfere with other treatments, and you've also weighed up the costs and benefits. So, if we're looking at natural remedies, the evidence can be a really mixed bag, and I'm sure a lot of you know about this. Some have strong evidence, others are promising but still uncertain. Sometimes it's just the evidence is inconclusive, or it just doesn't hold up under scientific testing. In some cases, you'll see a traffic light system being used. Green light often means, with usual safety checks, go for it. They're remedies backed by that strong, consistent, high quality evidence. So it means there's multiple well-designed studies that are behind them to show they are both effective and safe for most people. Fish oil, for one, is what we're going to speak about today. The amber or orange light just means exert a lot of caution when you're selecting these kind of products. It means the evidence here is promising, but it's also limited, or maybe it's not promising, but that still applies. Maybe the studies are small, maybe it's the fact the studies are short term or show mixed results, so they don't actually meet the primary endpoint. These remedies might help, they might not help, but more research is needed before we can actually be certain about the therapeutic purposes. So, Boswellia, for example, there's some good evidence behind it, but we still need those larger, longer studies before we can actually say with certainty it works for this condition, or it gives you this symptomatic relief. Red light just means that the high quality studies haven't shown any benefit. There's no credible evidence. Copper bracelets for arthritis, for one. Not sure if anyone's dipped into this territory, but the research consistently shows no therapeutic benefit beyond placebo. So sometimes you have to be careful of these money grabs when they pop up on social media. So turmeric, it is where we're starting our focus today. Has anyone explored this themselves? Does anyone cook with it? Take it in a capsule form? If you're not familiar with turmeric, or you just want to know a little bit more about it, it is a spice from the same family as ginger. It has been used in traditional cooking for thousands of years, but it's also been used in the medicinal context as well. It's only just now that medical science is actually backing up some of those traditional health claims made about turmeric and the compounds it contains. So the bright yellow color that you see in turmeric comes from that main bioactive substance called curcumin. And it's a curcumin that has the anti-inflammatory properties and is promoted widely for a really large range of inflammatory conditions like rheumatoid arthritis, for one. In more specific studies, researchers have hypothesized the benefits might extend to its protective effects on chondrocytes. So chondrocytes are basically those cells in the cartilage. So some researchers suggest it may have a role in protecting against cartilage degradation, but many of the claims around turmeric suggest its anti-inflammatory properties are comparable to NSAIDs like ibuprofen, like Nurofen, and it shares a similar side effect profile with no significant adverse effects reported in studies. So over the last 20 years, dozens of studies have actually explored its use for arthritis symptom management and disease progression. So while the evidence base is stronger for knee osteoarthritis than for other forms of arthritis like rheumatoid arthritis, some recent reviews also report the benefits around its anti-inflammatory mechanisms and found it may be able to give that symptomatic relief. But there's a lot of limitations and uncertainties when it comes to the actual research. If we take a look at the evidence, treatment with curcumin extract has been typically around 1,000 milligrams a day and has shown it can lead to clinically meaningful improvements in pain and function. In 2016, there was a review of 15 randomized controlled trials, and they looked at turmeric extracts and curcumin in osteoarthritis and rheumatoid arthritis and suggested that curcumin at a dose of 1,000 milligrams per day can reduce joint pain and stiffness and may have a role in improving function. So the randomized control trials primarily assess those outcomes using something called a pain visual analog scale and something called a Western Ontario and McMaster University's Osteoarthritis Index. You'll hear me refer to that as WOMAC. So these are the gold standard indexes widely used in arthritis research because they're validated, reliable, and sensitive tools. So when you see these being used in studies, it just means the study results are that little bit more trustworthy and comparable. In one of the meta-analysis of 3 high-quality randomized controlled trials, researchers found that curcumin supplements significantly reduced that arthritis pain compared to placebo, so say a sugar pill, and the difference in pain scores was just over 2 points lower on a standard pain scale. And this is a meaningful change for people who live with that daily discomfort. The results are what we call statistically significant, meaning that there was a confidence interval that showed this was unlikely due to just chance or coincidence. Another analysis of 4 randomized controlled trials found that turmeric led to a WOMAC score reduction, and that's a standard measure of joint stiffness, pain, and function of around 15 points compared to that placebo. So interestingly though, when turmeric and curcumin were compared directly with common pain medications like NSAIDs, there were no significant differences in effectiveness. So, meaning that turmeric might be as effective as some of the over-the-counter pain medicines for certain people, which is a good thing considering some of these side effects associated with that long-term NSAID use when it comes to risks of harm in the liver, the gut, and so on. So while this all sounds really promising, sounds well and good, the number of high quality trials is really small. I think that's something to keep in mind. I like to focus on these limitations as well. We need larger, longer studies. There's no clear consensus on things like the best dosage, the formulation. So some products will use whole turmeric, some will use just the curcumin extract, and maybe that's in different doses. Or some people, there hasn't been much consistency in treatment duration. So major organizations like the Australian Rheumatology Association, even in the NICE guidelines for osteoarthritis management, which are the most up-to-date and clinically relevant guidelines, you won't see turmeric or curcumin recommended as a standard therapy. And it's just due to the research gaps and the limitations there. So again, while the evidence is promising, it's not perfect. Most experts will rate the overall level of evidence as moderate due to small to medium study sizes, meaning that the study, if there's less than 500 people, not the best to actually apply that to the wider population. Differences in curcumin formulations, is inconsistent outcome measurements, short trial durations, and then there's also that moderate risk of bias. So before we're rushing out to go buy turmeric capsules, there's a few really important points to keep in mind. Most supplements have curcumin as the main ingredient, and it can be extracted from turmeric to give a much higher potency while it appears to be well tolerated. um, at several grams per day, it is poorly absorbed. So sometimes if you're looking at turmeric supplements or curcumin supplements, you'll see a myriad of different formulations that have been created to improve its bioavailability. Something you might see is piperine, which is a bioactive substance of black pepper. It's a common co-agent that's meant to help with that curcumin absorption, make it more available in the body. And there's a really wide range of proprietary formulations that combine curcumin with lipids and other chemical agents to help them become more bioavailable. Now, some people do get side effects from these supplements: diarrheas, headaches, nausea. Sometimes yellow colored stools could be a side effect. And so, just because turmeric is natural and mostly safe, it's really important to know it can still interact with certain medications. So, medications like aspirin, warfarin, certain herbal supplements, your risk of bruising or bleeding can be increased. Um, Additionally, it might affect how some diabetes medications work. So if you're taking medications to stay on top of those blood sugar levels, it's really important to always discuss these over-the-counter supplements with your doctor or check in with your pharmacist. So omega-3 fatty acids are a type of fat that's found in fish, shellfish, seeds, eggs, oils, many other foods, more specifically dietary supplements like fish oil. They're really well known for their ability to lower inflammation in the body by way of helping reduce the production of inflammatory chemicals. So, the most important compounds of fish oil supplements are actually the omega 3s, icosapent. I'm just going to keep it simple, but EPA and DHA. You'll find them mostly in oily fish like salmon, herring, sardines. Omega-3 fatty acid is also called alpha linoleic acid, ALA, which is found in plant foods like walnuts and soybeans and flax seeds. So omega-3s have many important functions in the body, but particularly an important role in keeping the heart and blood vessels healthy, which is why you often see fish oil and omega-3s promoted in the context of reducing the risk of heart disease, but they also play a role in keeping the immune system working normally. So, not only does regular consumption of foods high in omega-3 fatty acids lower risk of things like blood clots and irregular heartbeats and improving cholesterol levels, they may have a important role in inflammatory types of arthritis. So omega-3s are actually the most widely studied active ingredients for rheumatoid arthritis, but they may have an important role also in ankylosing spondylitis and psoriatic arthritis. So they do show a lot of promise in being able to reduce the inflammatory activity. But again, if we go back to the evidence, the studies vary in size, quality, dosage, outcomes, and that evidence isn't conclusive enough to say this is how they work therapeutically. But omega 3s in general are essential in the diet, meaning that our bodies can't produce omega 3 fatty acids on their own. We need these nutrients coming from our food and we need them for good health. So, regardless of their efficacy as treatment, they're definitely not discouraged at all. So, your omega 3s are the main constituent in fish oil supplements in more than 40 clinical trials. So, that's a huge number of studies. Research suggests fish oil has been effective for reducing joint pain, reducing stiffness caused by autoimmune inflammation. And when it comes to osteoarthritis, particularly of the knee, the evidence isn't as convincing. It's more stronger for inflammatory types of arthritis. Research Research suggests the dose needed to reduce that joint inflammation in rheumatoid arthritis is around 2.7 grams. It should be noted that 1,000 milligrams of fish oil capsules will only contain about 300 and 400 milligrams of EPA and DHA. So always check that label first. Make sure they stand up to the correct dosage. And usually the dose to get that anti-inflammatory activity, it could be anywhere between 9 to 14 standard 1000 milligram fish oil capsules taken a day, or 5 to 7 capsules of fish oil concentrate. So they're different supplements. Some people opt for the bottled fish oil of about 5 to 7 mils, and this is largely based on preference. As for osteoarthritis, high dose fish oil does not appear to be more effective than lower doses. So, again, that's just because the evidence isn't there. There is substantial evidence that supports fish oil as an adjunct for inflammatory arthritis, but we still need more evidence to increase that level of evidence to high. There's several reasons for this. Firstly, I guess there's a lot of variation in the omega-3 composition and dosages used across the studies, and it makes it hard to compare those results directly. The results from trials are often inconsistent, especially if you're comparing those effects for osteoarthritis versus rheumatoid arthritis. Many of the studies, again, they have small to moderate sample sizes, which limits how confident we can be about applying these findings to a wider population living with the disease. And then, of course, there's that moderate risk of bias. So we do need to use a lot of caution. We need to look out for the studies that back the claims. Most experts do agree that taking up to 3 grams per day is safe for most people. This amount has been studied extensively, doesn't usually cause serious problems. However, there's still going to be the risk of side effects. Sorry, just muting some people. And this could be a fishy aftertaste, which is a bit gross, but it's not harmful. Others might experience nausea, stomach upset, diarrhea. Some people find it helpful to take the supplement with food or trying to split the dose across the day. But the most important safety consideration here is the bleeding risk. So fish oil, it does have that mild blood thinning effect. So if you're taking warfarin or any blood thinning medication, you do need to be cautious here, especially if you are going for a surgery or any medical procedure. This can just help avoid any unexpected complications. And when it comes to getting your fish oil, there's so many different ways you can go about it. It's largely dependent on your preference. Bottled fish oils supplements are a popular choice, often because they're more affordable, more convenient than smashing 9 to 14 capsules a day. And the capsules are quite large as well. But you can also not forget about the benefits of eating fish itself. So fish provides many other important nutrients beyond omega-3 fatty acids. So it's important to consider that protein, the vitamin D, the minerals that all work together to support your health. So if you enjoy fish, incorporating it into your meals regularly is going to be a great idea. And not just for all those nutrients, but it can be comparable to the benefits you're getting from these supplements. But again, always talk to your doctor if you're considering going down the supplement pathway. Boswellia extract. So Boswellia is sometimes called Indian frankincense, and this is a natural resin that comes from the Boswellia serrata tree. It's been used in traditional Ayurveda for centuries, and these days scientists are actually taking a closer look at it, and it's because some of the results in the studies have been quite interesting, particularly when it comes to its active components called boswellic acids and their anti-inflammatory properties. So some of the proposed mechanisms here is that the compounds appear to block certain enzymes, which may have a role in producing inflammatory chemicals in the body. So much like the other supplements, they might be able to help with that symptomatic relief. If we're looking at the research, there's modest evidence that people with osteoarthritis who took Boswellia have reported less pain and stiffness compared to placebo. So over the last couple of years, particularly studies from 2020 and 2024, Researchers have run several randomized controlled trials to see what Boswellia can really do for the osteoarthritis. And when people with osteoarthritis took this supplement in doses between 100 and 250 milligrams per day, a lot of those participants reported less pain and less stiffness compared to those who took the placebo. And the improvements were measured using those tools I mentioned before, the visual pain analog scale and the WOMAC score. So the benefits weren't just on paper, but people described that real short term relief from the pain and stiffness in knee, hip, and hands. There was one standout multi-center trial in 2024 which enrolled 105 participants. So again, not the greatest sample size, but people were randomly assigned to three groups. There was a placebo, 150 milligram Boswellia um, group, and 300 milligram Boswellia group. They took the supplements twice daily. Each group had about 35 people within them. The treatment lasted for 90 days. So they were measured at different intervals across this 90 days. And remarkably, pain relief was noticeable in it as little as 5 days. The pain scores dropped by 45% in the low dose group and 61% in the high dose group. WOMAC overall scores improved by 68 and 73% respectively. And there were also some gains noticed in physical function, quality of life, and walking distance. There was some observation made with the inflammatory markers, except not a whole lot to speak to that, but the treatment was well tolerated. There were no significant adverse effects. So it's definitely caught the attention of many other researchers. In some other studies, there were similar signs and similar reports that this supplement might be effective for reducing inflammation. It may have a role in reducing some of that cartilage degeneration. In most trials, though, the treatment lasted for 4 weeks and it was given either orally or a topical cream. Some studies use special extracts designed to make it more potent or easier to absorb. And, we're not saying here that this is a magic fix, but it might be something worth exploring later down the track when we have more evidence and might find its way as part of a broader arthritis management plan. So some of the reviews consider this as a standout supplement, particularly for short-term relief of knee, hip, and hand osteoarthritis. But again, if we look at those limitations, studies are relatively small in sample size. Different studies use different extracts, dosages. There's a moderate risk of bias. We don't have nearly enough long-term research to talk about its ongoing benefits. And in terms of safety, doses used in the studies are generally considered safe for most people. Some side effects to be aware of is that some people can have reported stomach pain, nausea, diarrhea, headaches, heartburn, or mild skin itching. But there's really one important watch out, and that's the fact this supplement can interfere with the way certain blood thinning medications work. So those anticoagulants, warfarin, if you're on any of those or have any concerns, it's really best to go to the GP first before just adding it to your routine. And then cannabidiol. So CBD is something that pops up from time and time again over the info line. And it there does seem to be more research coming out in mainstream media as well, because it's being explored as a potential adjunct for arthritis relief. So CBD, it is a compound that is derived from the cannabis plant. Unlike THC, it doesn't cause a high, but it does have some intriguing potential medicinal properties. And researchers are more interested in its analgesic and anti-inflammatory effects. So supposedly CBD interacts with something called the endocannabinoid system. Just like we have a nervous system in the body, we've got an endocannabinoid system which plays a major role in regulating pain, inflammation, even immune responses. So by acting on this system, it suggested CBD might help calm inflammation and ease the discomfort. And right now, we have low to moderate evidence, which is also inconclusive, to suggest it might be effective for reducing arthritis and chronic pain, improving physical function, lowering inflammation, maybe helping with sleep duration and quality. But we've ruled out the evidence to support its use for hand osteoarthritis and psoriatic arthritis. Over the past couple of years, multiple surveys have been conducted: 2019, 2022, 2023. It's pretty much ongoing, but researchers have looked how people with arthritis are using CBD products. Most of the studies have been cross-sectional, meaning that these studies are designed to capture a snapshot in time as opposed to following people over months or years. And so the study is good for understanding what's happening now, but it's not the best study designed to talk about the cause and effect relationship. But what's interesting about these surveys is that pain reduction, around 44% of people reported that CBD have helped reduce pain levels. About 66% have reported they can do more day-to-day activities, so it's helped with that physical function. Many respondents have talked about how it's improved sleep quality, and sleep quality is a big part of chronic pain management and arthritis management in general. So there's indirect benefits of this supplement that have been reported. Medication reduction, so 31% reported reducing or stopping anti-inflammatory drugs, and 27% have reported reducing or stopping opioid use. And that's another indirect benefit. So many patient surveys suggest that CBD, particularly those oral forms, might offer benefits for pain, function, sleep, and maybe even reducing that medication use. And because much of this is based on that self-reported data rather than that long-term rigorous trials, we need more high-quality research to confirm how effective is this, who is it effective for, and at what dose. So there was one really notable study done in 2019 by Dr. Capano and colleagues. It was a prospective cohort study which involved 97 patients who were living with chronic pain, but many of those who did have arthritis and were on a long-term opioid treatment. Participants were provided a full spectrum CBD rich hemp extract, and that was available as an oral soft gel or a liquid drop. The dose was about 30 milligrams of CBD per day, which is moderate, and the study lasted for 8 weeks. And it was during this time researchers monitored pain closely, physical function, and the medication use. So this study wasn't a randomized control trial. It wasn't that gold standard we need to kind of build on, but it was important because it tracked real patients over time as they added CBD to their treatment. And with a lot of people reporting the improvements in pain and function, and an indication that CBD might help reduce opioid use, it might actually help us understand better how it could fit into a broader chronic pain management treatment, especially for those people who want to reduce that reliance on those stronger pain relief medications. In a more recent clinical trial that looked at synthetic transdermal CBD gel in people with knee osteoarthritis, participants were split into 3 groups. There was a low dose group of 250 milligrams per day, a high dose group of 500 milligrams per day, and a placebo gel. So there was no active ingredient within the placebo. They applied the gel twice daily over a period of 12 weeks. And the main goal was actually to see if the CBD gel could reduce the worst pain reported in a typical week by the end of the study. So a lot more people were involved in this study. There were 320 participants with that average age of about 62, all experiencing moderate to severe knee pain. And it was interesting to see that overall there was no significant difference in pain reduction between the CBD gel and placebo groups. In other words, the pain scores dropped similarly whether people got that CBD or took the placebo. When the researchers looked at the secondary outcomes, they actually found that the group who were using 250 milligrams per day, so the lower dose group, responded significantly better than the placebo group. And um, these were meaningful improvements when it comes to pain reduction and physical function. But interestingly enough, this effect was observed in the male participants and not observed in women. So, people who also had more stable pain levels at the very beginning of the study tended to respond better to the CBD gel. So, the trial didn't meet its primary goal, showing overall pain relief, but there were still signs of benefits for certain groups, particularly men and people with stable pain from the very beginning. So it might have a role in people with knee osteoarthritis, but we need more research to understand its benefits. So much like the other studies, the limitations are small sample sizes, short study durations, the variability in the products, lack of standardized dosing, placebo effects, potential bias, very much a limited focus on arthritis. But some of the concerns that do remain is the potential for cannabis to exacerbate any underlying psychiatric conditions such as anxiety and depression. So if you struggle with mental health, then that's a really important consideration to make. It's also the potential for this medication to interact with disease modifying anti-rheumatic drugs and non-steroidal anti-inflammatory drugs. So, while a lot of people do find relief through natural therapies, when we take any drug or natural remedy, it goes through a process in the body. It's absorbed, metabolized, and eventually excreted. And sometimes these products work in really helpful ways, but then they can also cause harm or interact negatively. And I don't know if everyone's been keeping an eye on what's happening in the media lately, and you've heard about what's happened with the vitamin B6 and how that's affecting the nerves. It's just a reminder to approach these products with caution, despite being labeled as natural, despite being available over the counter. For example, glucosamine can interact dangerously with blood thinning drugs. Curcumin can increase the level of medications in the bloodstream, which can lead to really serious side effects. If you're intending to have surgery soon, sometimes we don't want all the anti inflammatory activity that can slow blood clotting. Potentially, this could increase the risk of bleeding. So that's why it's really crucial to always talk to your doctor about any herbs, supplements, or over the counter products you're taking, so they can at least help you manage those possible interactions and risks. And of course, the more people that use these products, the more evidence we gain over time about their safety and their effects. But evaluating the evidence is really important. Quality and formulation really matter because supplements can vary widely in purity and potency, which affect their safety and benefits. And in Australia, there are very stringent guidelines in terms of um, ensuring that safety and quality goes through something verified by good manufacturing practice, making sure the supplements meet the strict guidelines and do what they say they're going to do. But proper dosage and duration are crucial to achieving certain benefits without those risks. And whilst these products are generally safe, there are very rare cases where higher prolonged use of, say, curcumin can actually harm the liver. Symptoms like unusual tiredness, dark urine, abdominal pain, these are all signs of liver issues. Anything that feels out of the ordinary after taking these products, you should always report these to your doctor or pharmacist immediately. And then another important point to raise and highlight why we need that person centered approach here is Sometimes these products are made from those natural products. So, glucosamine is made from seafood shells. So, people with shellfish allergies need to be careful. If you have a sulfur allergy or sensitivity, then glucosamine supplements often contain glucosamine sulfate. So, you could be reacting to that despite this product being safe for the most of the population. So always make sure you're taking a personalized approach and you're speaking to a healthcare professional about this. Just because it's natural, it doesn't always mean it's safe. Just be careful when choosing products, checking labels, be really critical when it comes to marketing claims. Um, all these natural remedies can have possible interactions with medications. There could be surgical risks. And if you have allergies and sensitivities, this is just why it's so important to talk to a healthcare provider before just taking any kind of product. So, hope that brings us to the end of the session, and hopefully, that covered a lot about, some of those products you've been considering taking or you're already taking and wanted to know a bit more about it. I will stop the recording just so we can open the floor to questions.